When we looked at the idea that there might be a malpractice crisis, we were principally interested in trying to work out whether the concerns that lawyers typically have about the role of courts were the best way to think about the type of crisis that we might be envisaging. So we thought about that in a number of ways. We first of all wondered whether the crisis was best understood in financial terms. Why do we spend such a lot of money on malpractice claims, and especially why do we spend such a lot of money on paying the lawyers to process malpractice claims? And we noticed how high a proportion of the money that is taken up in processing malpractice actually ends up not in the hands of the victims of mishaps, but in the hands of the lawyers who are processing them. So we wondered whether actually lawyers should be a little more cautious about thinking it's a great thing to get involved. And that led us to think about some of the alternatives. So we wondered whether the real issues behind the malpractice were about quality of care, and that led us to think about whether it was a reasonable assumption that more litigation would lead to higher quality of care, or whether other quality control mechanisms might be more effective. We wondered why people sued, and we considered the extent to which they needed to get proper explanations of what went wrong. And that led us to think about whether the best ways of getting to that were complaints procedures being improved, and they certainly need improving, or whether they were malpractice litigation cases themselves. And we also thought a bit about the culture that the malpractice litigation created. People sometimes talk about the challenges of a compensation culture, people rushing to litigation just in order to get money when it's not really deserved. And there are questions about that in the NHS context. Perhaps more importantly, though, are the suggestions that the more people worry about litigation, the more they might close up and not reveal what they think might have gone wrong. We also might worry that doctors do things not because they think it's the right thing for their patients, but because they're practicing defensively against the risk of being sued. And Ian Kennedy in the Bristol Royal Infirmary inquiry suggested that perhaps it was time for medical malpractice litigation to take a step back and as to use some form of no-fault system in order to mitigate what he saw as being the adverse consequences in terms of secrecy and lack of transparency that the fear of litigation created. And that led us into consideration of the current consultation about safe spaces, and the idea that the best way to improve healthcare quality in this country might be to model it on the safety investigation regime that, for example, the airline industry creates. And we explored the extent to which promoting better safety through that sort of mechanism justified a trade-off in terms of reducing the opportunities to sue. And we discussed how families involved in the discussions around the healthcare safety investigation branch were split, on whether or not actually the big prize was greater safety through transparency, which you would only get if you provided people a degree of immunity from personal complaint. And those families who felt that they had been severely wronged, that people had not taken their cases seriously, and they felt that any route to accountability was going to be important, and the idea of a safe space would undermine the accountability of health professionals. And those discussions remain extant at the moment, and we're waiting for the government response to the consultation process. So those are all ways in which we begin to ask, how should we think about the role of law in the purpose of improving the quality of healthcare? And is that the main criterion we should use? Or should we use a criterion based on the traditional functions of tort law, which we explored in the seminar, about getting distributive justice for people who are wronged? And it's going to be an important decision that you make, whether you think that the best way of considering healthcare law is in the context of the wider interest in good quality services, or whether you think the best way of looking at healthcare law is in the context of legal justice more generally and putting aside the peculiarities of the healthcare context.